We go to the US. We have Stephen from Radio World PRX, if I'm not mistaken. Stephen, can you hear us, please?
I can hear you. Can you hear me?
Yes, please go ahead.
Oh, perfect. In Yemen, you'll know that the first COVID-19 case was identified a week ago. And since then, there have been reports of contact testing, but no other cases have been identified. What do you think Yemen needs now to fight the pandemic, and what do you know is being done?
WHO continues to support all communities in Yemen. We've put in place, or are supporting, local health authorities and agencies in implementing case finding and contact tracing, and using polio teams and other teams to do that. And yes, we have not detected further cases, but that is not to say that that has not occurred. We are constantly fearful of disease exploding in places like Yemen or in Syria or in Iraq or in many of the fragile states in which we work, in which many people have been displaced, many people are living in overcrowded conditions. So we have to remain very much on alert. But what's even, I won't say more important, because it's difficult to say something is more important than COVID-19 right now, but for many of these communities, they have direct, real and present dangers in their lives. And there are pregnant women who need to give birth safely. There are children who need to have infections treated. There are elderly or older people who need to have chronic diseases treated. And therefore, preserving life-saving interventions, preserving feeding programs, preserving humanitarian interventions is just as important. So while we work to try and contain COVID-19, we have to remember that these people are in desperate need in many, many countries and have been abandoned for years. Many agencies, including our own, work with local communities and with governments to try and ease the burden on these people. And again, Dr. Tedros launched the humanitarian appeal for COVID-19 a number of weeks ago now, and we do thank all countries who've responded to that call. And we thank Mark Lowcock and his team on the humanitarian side, and all our humanitarian partners for their untiring efforts to continue providing services, UNICEF and others, in these situations. So we are concerned, we are alert, but we're also aware that these populations face many more difficulties than COVID-19, and we must continue to provide essential services to them, regardless of the other situation, the political or conflict situation in those countries.